Let's take a wealthy or a middle-class person, and let's take a poor person. For the poor person, at the moment, they are dependent on the public sector for their care. They will get their healthcare free of charge at the point of delivery once the NHI is implemented. But instead of being sent only to public sector facilities, public sector providers, the fund will send them also to nearer private sector providers who may have spare capacity. And we know that many private sector hospitals and other providers have a lot of spare capacity, up to 70% in some private hospitals. For the person who is middle class, maybe a little bit wealthier, who has a medical scheme, once the NHI is implemented and as the benefits are taken over and covered by the fund, and I must stress this is a systematic process, not something that will happen next year or all at once. But once that point is reached and benefits are covered by the fund, then you don't need a medical scheme. In fact, the medical scheme will not be allowed to pay for those benefits. The fund will be paying for them. You too will go to the nearest facility, and most people who have medical aids live near private facilities anyway, and you will get your healthcare at point of care free of charge because you will have paid for it. And you are going to pay for it by increasing tax. That's what people are scared of. So the increase in tax is likely to be, in fact, it will definitely be less than you currently pay in your medical scheme's premium. So what the bill says is that everybody, all 61 million of us who live in this country, should choose our primary point of first care, and that's in primary health care, where we will go and register. It just means you open the file once and you never have to open it again, because that number will be available to you anywhere you go in the country, whether it's a public or private provider, provided they have been accredited by the fund and therefore going to be paid by the fund. And that will take time to achieve as well. Now, you have chosen that point of care because it's close to your home, and you know you're going to be able to access it on a regular basis for your normal minor ailments and care that you need. When you need anything beyond that care, that primary health care provider will refer you to the level of care that they are not able to provide. And that's in the benefits package